TB prevention and vaccination is handled in a separate section to which we now turn. This tab for prevention of TB disease is used to refine projections in those populations needing preventive treatment to allocate prevention regimens by drug, susceptible, and drug-resistant strains and age group. The outputs from this section feed into costing TB prevention regimens among patients exposed to risk for drug-sensitive and drug-resistant TB disease, as shown in the costing video. Default splits between drug-susceptible and resistant strains, which the user can edit, are based on the distribution of drug-resistant and drug-susceptible strains among active TB patients. For the following indicators, the user can document percentages for adults 15 plus and children 0 to 14 years old, noting that an age disaggregation for TB prevention is needed as regimens for adults and children have different costs. The proportion with presumed or confirmed TB infection of a drug-susceptible strain and the proportion with presumed or confirmed TB infection of a drug-resistant strain. The split between drug-susceptible and drug-resistant exposure is based on the overall split from the resistance profile editor. It is averaged over new and re-registered status of TB patients. This default value can be edited should the user have data to suggest a split that differs from the drug-susceptible and resistant split for TB patients treated for active TB. It must be noted that the model does not establish an explicit link between the drug, sensitivity, and resistant status and TB infection following an infection test for those patients who receive prevention treatment. The vaccination tab currently states only inputs for BCG vaccination. It captures the number of infants and neonates obtained from the demographical component of IHT who receive BCG immunization. This number is used for costing purposes only, and its impact is not modeled, being small over the 5 years of a typical strategic plan. A large-scale vaccine for adults is not yet featured by default in the intervention menu of the TB module of the IHT tool.